हेलो स्टूडेंट्स, आज हम ऑक्सीजनेशन के कुछ MCQs डिस्कस करेंगे। तो लेट गेट स्टार्टेड। क्वेश्चन नंबर 1, ए पेशेंट हु स्टार्टेड स्मोकिंग इन adolescence and continue to smoke 40 years later come to the clinic. The nurse understands that this patient has an increased risk of being diagnosed with which disorder? तो हमारे पास ऑप्शन है ए अल्कोहलिज्म एंड हाइपरटेंशन, बी ओबेसिटी एंड डायबिटीज़, सी स्ट्रेस रिलेटेड इलनेस, डी कार्डियोपल्मोनरी डिजीज़ एंड लंग कैंसर। तो इसका सही आंसर है डी कार्डियोपल्मोनरी डिजीज़ एंड लंग कैंसर। Question number 2. A patient has been diagnosed with severe iron deficiency anemia. During physical assessment, for which of the following symptoms would the nurse assess to determine the patient oxygen status? तो A. Increase breathlessness but increase activity tolerance. B. Decrease breathlessness and decrease activity tolerance. C. Increase activity tolerance and decrease breathlessness. D. Decrease activity tolerance and increase breathlessness. तो इसका सही आंसर है decrease activity tolerance and increase breathlessness, option D. Question number 3. A patient is admitted to emergency department with suspected carbon monoxide poisoning. Even though the patient color is ruddy, not cyanotic, the nurse understands that the patient is at risk of decreased oxygen carrying capacity of the blood. Because carbon monoxide does which of the following? A. Stimulate hyperventilation, cause respiratory alkalosis. B. Form a strong bond with hemoglobin, creating a functional anemia. C. Stimulate hypoventilation, cause respiratory acidosis. D. Cause alveoli to overinflate and leading to atelectasis. तो इसका सही आंसर है बी. Form a strong bond with hemoglobin and creating a functional anemia. Question number 4. A 6-year-old boy is admitted to the pediatric unit with chill and is a fever of 104 Fahrenheit or 40 degrees centigrade. What physiological process explain why the child is at risk of developing dyspnea? A. Fever increase metabolic demand and require increased oxygen need. B. Blood glucose store are depleted and the cell does not have energy to use oxygen. C. Carbon dioxide production increase and as a result of hyperventilation. D. Carbon dioxide production decrease as a result of hypoventilation. तो इसका सही आंसर है फीवर, increased metabolic demand and required increased oxygen need. A. Question number 5. A patient is admitted with the diagnosis of severe left-sided heart failure. The nurse expected to auscultate which adventitious lung sound? Number A. Sonorous wheezes in the left lower lung, rhonchi mediastinum. C. Crackles only in the apex of lung. D. Inspiratory crackles in the lung bases. तो इसका सही आंसर है डी. इंस्पायरेटरी क्रैकल्स इन द लंग्स बेसिस. क्वेश्चन नंबर 6. द नर्स इज केयरिंग ऑफ ए पेशेंट हु हैज़ डिक्रीज मोबिलिटी. Which intervention is a simple and cost-effective method for reducing the risk of stasis of pulmonary secretion and decrease the chest wall expansion? Number A. Antibiotics. Number 2. Frequent change of position. Number 3. Oxygen humidification. Number डी चेस्ट फिजियोथेरेपी। तो इसका सही आंसर है फ्रीक्वेंट चेंज ऑफ पोजीशन। Question number 7. A patient is admitted with severe lobar pneumonia. Which of the following assessment finding would indicate that the patient need airway suctioning? Number A. Coughing up with thick sputum only occasionally. Number 2. Coughing up thin, watery sputum easily after nebulization. Number C. Decrease independent ability to cough. Number D. Lungs sound clear only after coughing. तो इसका सही आंसर है सी, डिक्रीज इंडिपेंडेंट एबिलिटी टू कफ। Question number 8. A patient was admitted after a motor vehicle accident with multiple fracture rib. Respiratory assessment includes signs and symptoms of secondary pneumothorax, which include which of the following? A. Sharp pleuritic pain that worsen on inspiration. Number B. Crackles over lung bases of affected lung. Number C. Tracheal deviation towards the affected lung. D. Increased diaphragmatic excursion on site of the rib fractures. तो इसका सही आंसर है ए, शार्प प्लूरेटिक पेन दैट वर्सन ऑन इंस्पायरेशन। Question number 9. A patient has been newly diagnosed with emphysema. In discussing his condition with the nurse, which of his statement would indicate a need for further education? A. I will make sure that I rest between activities so I don't get too short of breath. B. I will rest for 30 minutes before I eat my meal. C. If I have a trouble breathing at night, I will use 2 or 3 pillows to prop up. D. If I get short of breath, I will turn up my oxygen level to 6 liters per minute. तो इसका सही आंसर है डी, इफ़ आई गेट short of breath, I will turn up my oxygen level to 6 liters per minute. Question number 10. The nurse goes to assist a new patient and find him lying supine in bed. The patient tells the nurse that he feels short of breath. Which nursing action should the nurse perform first? A. Raise the head of the bed to 45 degrees. B. Take his oxygen saturation with a pulse oximeter. C. Take his blood pressure and respiratory rate. D. Notify the health care provider of his shortness of breath. तो इसका सही आंसर है ए, Raise the head of the bed to 45 degree.